murder count continues to climb as a man is killed in Nassau Village. Loretta Talks Nhi says the rush of NHI could spell disaster. One web shop forced to close its doors, plus plans to lower unemployment. We've got those stories and more coming up tonight. I'm Kyle Joaquin, and NB12 starts now. To NB12. Another life was claimed by gun violence this afternoon in Nassau Village. According to police, it was around 3 p.m. that the victim was walking along Alexandria Boulevard near his home when a black Honda Odyssey pulled up and shots were fired. And when the gunshots were finished, the victim's body was lying on the side of the road.
We don't know the motive at this time. But we're going to appeal to members of the public who was walking, passing, or driving. If they had seen anything or heard anything, to please give us a call. That will help us in our investigation.
This is the third murder in the area within a matter of weeks, but police weren't able to say whether this is connected to any others.
We're still in the early stage of our investigation. As time goes on, we will look at all of these matters that are reported in this area and see where that goes.
As police are processing the scene, a young relative was stopped by police as she made her way under the yellow tape. This latest killing is murder 138 for the year, the highest ever in the country. Bottomy said with such activity happening in the area, residents should notice an increased police presence tonight and into the weekend.
Officers will be in this area as they've been in all areas. Okay, so if anything is likely or might happen, officers will be in this area. All right, thank you.
In other news, the Christie administration's rushed plans to implement national health insurance may spell economic disaster for the country. This, according to Long Island MP Loretta Talks Nhi, who today hit out at the lack of information surrounding NHI's rollout and demanded government be more forthcoming with its plans. Dana Smith reports.
This obviously is a rush to meet a promise that can end for the Bahamian people in disaster in terms of our stability economically.
Noting there's a level of uncertainty surrounding the scheme, the Long Island MP said government has yet to answer a lot of questions about it and said it seems to her that the Christie administration's plan to implement the scheme is just a rush to fulfill an election campaign promise.
With NHI, as I understand it today, I think the challenges we have is exactly what the leader of our party has said. It is, in fact, being rushed. We have to look chronologically at what the government, this administration said. They said during the campaign that they were going to have this rolled out within the first year. We're now down to their winding down period, going into the last portion of this 5-year period, and now they're trying to rush this.
Butler Turner said there's still a lot of unanswered questions surrounding NHI, and its cost is the biggest question of them all. With just weeks left until NHI's official January 1st implementation date, government has yet to reveal exactly how much it's going to cost. Health Minister Dr. Perry Gomez said on Monday, costing is still under discussion, but he admitted it won't be cheap. According to a report by Sanigest International, NHI would cost between $362 million on the low end and $633 million on the high end annually.
So here we are today with a government that is rushing to move forward with something in 3 weeks, as you've rightly said, and we, the Bahamian people, the taxpayers, the ones that are going to have to underwrite all of this, we essentially do not know what burden this is going to place on the public purse.
But it's not just the public that's in the dark on NHI. Butler Turner charged that the insurance sector and healthcare providers have not been adequately engaged by government.
They are partners in the healthcare of our country. And it appears to me that the government has really not been very engaging with the two major factors, the healthcare providers and the insurance industry. And so this is why I think that, we must continue to reiterate that this is truly being rushed. It's not being managed properly from a government and from an executive standpoint so that we can actually know and so that the other stakeholders can know what is required of them.
Charging that that government has not been forthcoming in providing enough information to properly inform the public, Butler Turner said it's time to demand answers.
The government has yet to answer these very real questions. What is the cost? Who's going to be covered? Who's going to be cut off from the private care until this actually is something that is realized and actualized? I think that as a people, we should demand answers to those questions, and the government has not been forthcoming in giving us those answers.
Government has said it will introduce NHI on January 1st, and the initial phase will focus primarily on client registration. There have been calls from the F&M and the Chamber of Commerce for the scheme to be delayed, while others have called for the government to engage in increased dialogue with the public. Reporting for NB12, I'm Dana Smith.
Well, leaders of the Democratic National Alliance weighing in on the controversy surrounding NHI and suggested that they too agree with the government that no delay is needed. Simone Davis reports.
After many expressed concerns over NHI and some even called for a delay or a pause before the implementation process, members of the Democratic National Alliance said they don't believe the government should delay the process, but proceed as planned.
DNA Deputy Leader Chris Mortimer said the government should ignore the naysayers and push forward with its phased approach to implementing NHI in less than 3 weeks.
National health care is a laudable and noble one, and one whom we believe time has come and should begin. Delaying is not an option. It will only add further to the cost of implementation. And as the government has not put forward a defined benefit package, this is what the DNA would like to see. We wish to see a defined benefits package where all essential medical services are included.
Using value-added tax as an example, Mortimer said there was great uncertainty surrounding NHI's impact, but due to the input of hardworking qualified Bahamians, VAT's implementation was successful. Mortimer said access to health care is a fundamental right for all citizens, as he called on the government, the private insurers, and other stakeholders to work together.
From the perspective of the DNA, access to quality health care is a fundamental right of every single Bahamian. And as such, it is our view that stakeholders such as the government, the insurance industry, healthcare, must work together to ensure a functioning universal healthcare system.
As part of its recommendations, Mortimer said the DNA wants to see children remain covered by their parents' insurance until age 26, regardless of whether they attend school. Mortimer said it's easy to join the clamor of negativity that is so prevalent in the Bahamas when there are no options or solutions provided, but all rhetoric. He also agreed that the implementation of NHI should begin with registration of Bahamians.
We support the implementation of the National Health Insurance Scheme. We think the implementation should start with the registration of Bahamians, and we think it should start in January. We believe that the system will work because we are Bahamians. We know what it's like to step up to the plate and make things work. That's been our history.
Reporting for NB12, I'm Simone Davis.
A web shop that was fighting to keep its doors open has been ordered to cease operations. However, the company's CEO claims the denial of a license is discrimination and to close its business would be crazy. Bet Vegas, one of 9 gaming houses that applied for a gaming license, was mandated to close its doors last month. The company reportedly did not meet the burden of proof to be awarded a license. However, it was granted an ex parte ordered by Supreme Court Justice Roger Gomez on October 26th, giving the operator liberty to continue its operations pending the hearing of an appeal application. But on Tuesday, Gomez set aside that ruling. In a statement, the gaming board said the principal of Bet Vegas, who was present when the ruling was handed down, has since been advised by the gaming board to cease their operations by Monday, December 7th. Further, the public is advised that as Bet Vegas is not licensed to conduct gaming transactions, they should not engage in any gaming activities at any Bet Vegas locations and should seek to retrieve any and all funds held on account with the company. But the news doesn't appear to be sitting too well with Bet Vegas. When contacted, Bet Vegas CEO Anthony Brown said that his company has met all of the requirements and paid all their taxes and that they will file an appeal. He said he feels this is blatant discrimination and that he will not just walk away from his company after such a large investment. That, he said, would be crazy. He said, quote, "I will say more in the very near future." But the company also took to its Facebook page. In a post, it said, "Over $1 million spent in taxes and fees, 11 locations throughout the Bahamas, about 86 direct employees with almost an additional 40 third-party agents, and to think of it that the minister has said in the news that Bet Vegas could not maintain employment or show the capacity to generate taxable revenue." The post continued, "I wonder if he got the factual information from the executives at the gaming board about Bet Vegas, or was that statement fabricated to justify the unfair treatment and victimization of Bet Vegas during the process?" And in another post, the company said, "Bet Vegas did everything right. No tipping, though." Tourism Minister Obi Wilchcombe announced last month that 8 web shop operators were awarded conditional gaming house operator licenses. The operators granted licenses were FML Group of Companies Limited, Ashore Win, Chances Games, Paradise Games, Island Luck, Percy's The Island Game, Asu Draw Plus Spin, and Bahama Dreams Web Cafe. Some of the standards operators had to meet included Bahamian ownership, financial stability, compliant server location, compliance with the December 2014 affidavit on premises and agents, and sufficiency of contributions required by the Gaming Act.